Hello friends, I'm Dr. Aman Gupta, Senior Consultant Urology and Kidney Transplant, Fortis Group of Hospitals, New Delhi. Friends, never ignore testis pain or scrotal pain in young boys. This is very important to understand because it can be because of a critical condition called as torsion of the testes. What is torsion of testes? As we all know, testes is supplied by artery, veins, and nerves as any other organ. However, testis is an organ which is hanging in the scrotum, and in some boys it can get twisted on its axis, leading to pain in the testis. Why it is important to diagnose? Because if not diagnosed within 4 hours, it can lead to permanent damage of the testis. How it happens? As I mentioned, it's supplied by blood vessels like any other organs. Once it is twisted around its axis, the blood supply will be cut off, and within 4 hours, testis is permanently damaged. So, whenever a young boy complains of any pain in the testes, never ignore it. Very many times, parents assume that pain in the testes is either because of some trauma during playing, or the child is just imagining things, and they never reach the hospital in time. Unfortunately, the only treatment for testicular torsion is a surgical correction. How it is done? Under anesthesia, the scrotum is opened by a small cut. The testes, which have rotated on its axis, are corrected and brought into the correct location, and then they are fixed with the skin of the scrotum so that this thing never happens again in future. In fact, this thing can happen in the opposite testis also, so simultaneously that testis is also fixed during the operation. So unfortunate part is that very many times it is missed by parents also. Very many times children don't tell their parents about this any pain or any of such condition. And another unfortunate part is that sometimes doctors also miss this condition. They may falsely assume that or diagnose it as a testicular infection. So it is very important that you go to the right place and the right person. It is dealt by a urologist. Always go to a center where surgical facilities are available. What happens is that very many times parents ask their general practitioner or pediatrician on the phone, and unfortunately a misdiagnosis can happen. So whenever a child or young boy complains of such pain, always go to the nearest biggest center where surgical facilities and a urologist is available. If diagnosed within 4 to 6 hours, it can be salvaged. Testis can be saved. However, if the diagnosis is delayed or the parents are not able to reach the hospital on time, the testis is unfortunately permanently damaged and very many times needs removal also. Although one testis is sufficient for a child to carry out its reproductive functions later in the life, however, it can be an emotionally traumatic experience for the child as well as the parents. So, dear friends, whenever a child complains of pain in the testes, never ever ignore it and take timely help. Thank you so much.